So you shared that you went into your personal sabbatical and you knew what you wanted to do, but you didn't have the courage to share it. What changed?
So I think what changed is, that I left that job and was in a situation where I had an opportunity to decide what's next. And that is either I can go forward and, apply for and try to find other jobs, or I can try to create this thing with colleagues together. I guess it was a little bit of a sense of, maybe a little now or never. And if not now, when? And ... all of that. I also have to say, all of these women that I had talked to were uplifting me in a way. And so it may not be that I actually had the courage. It may be that I had the support to help me take those next steps.
I love that. I also love the fact that you said you were doing a needs assessment ahead of time. Well, really,
It's accidental.
really just having conversations, assessing, realizing that there are themes, that there is something here, and then in doing so, have that first convening, build out organization. What did that initial push as a collective look like?
Yeah. So, I think our original ideas were around how can we have a greater impact together. So, me, myself, and I am probably not going to apply for a $15 million grant and get it and make a big change, but maybe me, myself, and I and other people coming together and figuring out how our strengths align could go after this grant and have a bigger impact. So that was a lot of our focus at first was, how do we set up a process by which we are individual, entrepreneurs with our own business, but collectively we're doing work together. So that's what we focused on at first. And to be honest, we got really, we got a little tripped up in some of the details of like operationalizing that. So how do you decide, what funding you're going to apply for? How do you decide who actually gets the work when it comes in? Are you going to decide by seniority or level of experience? How are you going to decide, what rates people are paid? Are they going to be paid this based on seniority or that based on, less experience? And we were going to kind of spin out on those details. And so we had to say, you know what, we don't know. We're going to start experimenting and we're going to talk about how those experiments are going. And by that, I mean, we were just going to go after work and start trying to do it and learn from it and document it and like say, what did we do right? What did we do wrong? How are we going to do it better next time? And on and on and on and learn from that process. A year and a half ago, maybe, we actually just put one post on LinkedIn that said, we are interested in, any consultants who might be interested in partnering on possible work. And I was overwhelmed by the number of people we heard from. And so I've had conversations with everybody that's reached out to us, and I was consistently amazed by the talent of people that I was speaking with. And, there's both people like me that are maybe more senior in their careers that are just sort of fed up. And so they're going on their own and working on their own because they're fed up. And then there's lots of younger people that are like, I'm not even going that way. I'm going my own way and I'm starting my own business and here's how. And I'm like, wow, if I certainly wouldn't have done that at the same, point in my career. It's pretty exciting actually. And so we've got now, I think 40 consultants and there's probably 30 who are like not on a waiting list, but who I just haven't had the opportunity to talk with now. you know, I see like this community that you have with Public Health Millennial, and there are lots of other kind of member groups and communities popping up. So people are really like getting together and helping each other out and figuring out how to do this whole career thing, which is really exciting to me.